Good morning, everyone. I'm Chris Murphy. I have the honor of representing Connecticut in the United States Senate and joined here today by my colleague in the Senate, Dick Blumenthal, and of course, Governor Ned Lamont. We're standing in front of the Colt Gateway Complex, which is where our district offices are located, and I'm glad to have you all here today. Listen, first and foremost, let me thank Governor Lamont for his incredible leadership over the course of the last several months. Connecticut went from being a hotspot to a success story with one of the lowest transmission rates in the nation because of the steps that the governor took, but just as importantly, all of the individual actions that people here in Connecticut took. I've had the chance to explain to my colleagues in Washington the reasons for Connecticut's success. We took decisive action. The governor decided to shut down places of public congregation until it was safe to reopen those places and not a day sooner. But we also built an apolitical mask-wearing culture in this state where we didn't see it as an attack on anybody to wear a mask or to not wear a mask. And because of that, we are at a point today where we can claim some level of success. But we know that our success could be short-lived. As this virus spreads throughout the majority of the country, it can find its way back to Connecticut. And so we need to mount a true national effort in order to make sure that every state has the success that Connecticut has. That's the only way for us to adequately protect us here. But we're here as well to talk about the need for the federal government to step up and help the state of Connecticut and the rest of the country fund the expenses related to coronavirus. There is no way for Connecticut to continue its success if we are faced with a multi-billion-dollar deficit this year and next year. And there is no way for Florida or Texas or California to fund the enormous expenses of all of these new cases without additional federal funding. Now, Dick and I don't want to be here in Connecticut today because we'd rather be in Washington debating legislation that sends money back to Connecticut and states like Connecticut. We love being in Connecticut, but right now we shouldn't be on recess. The Senate should not be on vacation. The Senate should be working, passing legislation to send money to the state of Connecticut and to 49 other states to help with the expense of combating this virus. And right now, Governor Lamont and 49 other governors are making really tough decisions about how to reopen businesses, about how to reopen schools safely, without any commitment from the federal government to help them with those expenses. That is an abomination. It's an abomination that the Senate isn't debating right now legislation that would put money into the hands of school systems and superintendents and principals to help reopen schools safely. It's unconscionable that the Senate isn't in session right now talking about legislation to help Governor Lamont and other governors continue to increase the number of testing sites. This epidemic is raging. It is not abating. And Congress needs to pass legislation to help states balance their budgets. We have recognized the importance of funding shortfalls. We have recognized the importance of helping organizations fill funding shortfalls in the private sector. The airlines saw a catastrophic decline in revenues, and the federal government stepped up and helped those airlines fill that gap. Tens of thousands of small businesses all across the country saw a dramatic decline in revenues as they were forced to shut their doors. The federal government set up a new program called PPP to help those small businesses fill that funding gap. Well, the federal government needs to apply the same principle to states that we did to the airline industry. States have seen an incredible and catastrophic decline in revenues. And the federal government needs to help fill that gap. And so we are going to be returning to Washington next week, trying once again to convince Senator McConnell to take up legislation that has passed the House of Representatives that would send, over the course of the next year, $7 billion to the state of Connecticut. And we hope that he will heed our call. The House has done their job. They've passed legislation that would send $500 billion to states, another $300 to $400 billion to municipalities, that would prevent tax increases, that would make sure our schools can reopen safely. And we hope and expect that our Republican colleagues in the Senate will take up that legislation or some meaningful version of that legislation in the next several weeks. With that, let me turn it over to Senator Blumenthal and then to Governor Lamont.
Thank you, Chris. Over the last 2 weeks, in fact, over the last 3 months, but particularly in these last 2 weeks, I have been all around Connecticut. I've been to child care centers and small businesses, restaurants, all across the state, including state parks. I have been absolutely inspired and impressed by the unanimity of Connecticut's response, how people have come together in a very courteous and nice way, telling each other to do the right thing. I've been reprimanded when I've been neglectful, a good thing. And so I think that we've seen leadership, not only from Governor Lamont, but also from the people of Connecticut. Leadership for the nation is what Connecticut has provided. And Governor Lamont, if he has erred, it's been on the side of caution. And it's proved right, absolutely right. And so his good judgment and his leadership have provided a model. To Mitch McConnell, my message is, lead or get out of the way. Lead or let us move forward with the HEROES Act as it is right now. We cannot compromise people's lives. You know, a lot of times in the federal government, we do things that are a luxury or a convenience. This measure is a necessity. It's a healthcare necessity, an economic necessity, and the healthcare and economic crises are tied together inextricably. We said so at the beginning, and it's proved true. Let me give you a few examples. Child care. I just came from a meeting of child care advocates. Within a year, 80% of all our child care centers will close in Connecticut. 80% will close unless we pass the HEROES Act with a minimal amount of funding, $10 billion, for child care around the country. Around the state of Connecticut, 45,000 children will lose child care spaces. Those are children who will stay at home, and their parents will have to stay at home, which means they can't teach in our schools and they can't work in jobs that mean they will go with unemployment insurance. It is an economic necessity. Child care is more than just a good thing that we should aspire to do because we care about children, we're big-hearted, we're humanitarian. It's an economic necessity. Hazardous duty pay. I have been to hospitals, to grocery stores, to postal centers, where the frontline workers have been there reporting for duty. And right now, as a matter of fact, Stop and Shop is saying it's going to cut the 10% bonus that it was giving to people, even though it is making more money than it did last year. Hazardous duty pay in the HEROES Fund is absolutely essential. The HEROES Fund, which I have been advocating is in that act. And it would provide up to $25,000 in hazardous duty pay for every frontline worker, retroactive to the beginning of this crisis. The latest estimate is that local governments are going to be in deficit on the order of $470 million. That amount is backbreaking for taxpayers. It will mean either massive tax increases or layoffs of firefighters, teachers, police, sanitation workers, public works. It is the only account that local governments can cut. They can't just unilaterally cut pensions, and they can't raise money from a rainy day fund because they don't have one. Connecticut will have a deficit of $2.5 billion. Its situation is better than most states because of the rainy day fund and sound management, but it will be critical for them, for the state government as well. So we are talking about make or break needs. And to take maybe one of the smallest amounts, $3.6 billion, out of a multi-trillion-dollar package, $3.6 billion, you know what I'm talking about? Election security, mail-in balloting. We are going to have voter suppression on a scale unseen before in this country unless we guarantee voter security, unless we provide the kind of ballot boxes and screening and signature checking and other kinds of election security that is necessary for expanded mail-in balloting, which I hope Connecticut will approve in the special session, and every state in the country should have, and many states are ahead of Connecticut, but what every state needs is that $3.6 billion in the HEROES Act for expanded mail-in balloting with security that enables people to vote safely without having to stand in line the way they did in Wisconsin and Georgia and other states. Mitch McConnell said yesterday that he's considering a $1 trillion package. He said, we need straight talk. He said, we don't want a liberal wish list. Well, straight talk to Mitch McConnell should be, do your job. We need action, and we need a heroes fund that matches the heroism that we have seen over the last 3 months. The heroism here in Connecticut, the hardship and heartbreak continues. We are not over this pandemic. We are not done with this crisis. The Heroes Fund is another down payment on what we need to do to preserve America as we know it. And I am really proud and grateful for the leadership that Governor Lamont has provided, and happy to yield to him now.
Well, thanks, Dick. I'll tell you, you want some straight talk? I think we need Chris Murphy and Dick Blumenthal just need a few other like-minded senators. So our states, 50 states across the country, aren't held hostage by this Republican Senate. You know, our budget is already in place. We're already in the fiscal year, and there's a big hole there we don't know quite how to fill. Let me back up for a second. These guys did incredibly good work when it comes to the CARES Act. And Chris Murphy and I spent a fair amount of time talking about small business and a forgivable bridge loan, which became known as the Paycheck Protection Program. And that has allowed thousands of our businesses, about half of our small businesses, Dick, to power through. Those monies are now running out. The end of that 3-month period is done. Most of those companies are getting back to work right now, but I'll give you one idea, and that's this. A lot of them still can't open. A lot in the hospitality, bars, events. Here's an idea. You've got $100 billion still left in that PPP program. Allow those companies that we've still closed down an option to get a second PPP loan. I think that would allow them, give them another 90 days as we get this economy going. The CARES Act, and thanks to Chris and Dick, we got through on a pretty timely basis, was so important. State of Connecticut received almost $1.4 billion. And now Melissa McCall is figuring out how to allocate that. I mean, I can tell you the educators want a third of it. I can tell you that the hospitals want a third of it. I can tell you that state government, in terms of overtime and things, need another third of it. I can tell you that not-for-profits need a third of it. I can tell you if we're going to do the testing we need to do, that takes a third of it. I can keep going, but you can see the nature of the whole that we're trying to balance right now. And maybe in another era, we'd be able to take that money out of the surplus. But one thing the CARES Act did not do, or was provide for the loss of revenue. We've lost, probably $2 to $3 billion in revenue in this next fiscal year. And I forgot to mention the municipalities that need the help as well, need to know what we will be able to do to help support them. And that's why this HEROES Act, we've got to get this passed, we've got to get it passed on a timely basis. This allows our universities to know what they can count on as they go forward. This allows our local municipalities what they can plan accordingly. Tell us whether the feds are going to pay for testing, FEMA will pay for some of that, or we need to do that ourselves. But these are the type of things that allow us to plan and keep up the good work that we've got going here in the state of Connecticut right now. The other thing Mitch McConnell said, I remember the headline in the Wall Street Journal, this is a couple of months ago, how the world has changed. And that's when Mitch McConnell said, I don't want to bail out those blue states. And the Wall Street Journal read, why should Florida bail out New York? Why should Florida bail? Do you remember that headline? Well, now the shoe is on the other foot in this sense. We got 50 states, all of whom are crushed in terms of declining revenues and accelerating expenses. And the last thing you want is what they did in 08, 09, where they didn't do enough, and we ended up having to cut personnel, cut nurses, cut teachers, cut frontline workers, and potentially raise taxes. That would be the worst thing in the world for this economy to get going. So pass the HEROES Act and do it promptly. Thanks, everybody.
Any questions? $25,000 going back retroactively in hazardous duty pay for every frontline worker across the country. That's federal money. Doesn't come out of the hospital's accounts. And these frontline workers are continuing to work in those hospitals, as you know, under tremendous pressure still. And it would also provide, in my view, frontline pay for teachers. You know, one of the irony here is demagogues are demanding that kids go back to school, that every classroom be reopened. But they are opposing the money that's necessary for schools to reopen, and they must reopen safely. Everybody wants schools to reopen. The question is how to do it safely. And anybody who opposes this kind of funding for schools is saying, in effect, we don't care how safe you are, we don't care how healthy the classrooms may be, we're just putting children at risk and staff. And so the hazardous duty pay that those teachers need and deserve ought to come from the HEROES Fund. Those are the estimates that I heard literally less than an hour ago. On a phone call with early childhood advocates, we can get you all of the specifics as to who to contact. They were up on the screen. It was, by the way, it was a press conference, so I'm assuming someone was listening, but it was recorded. So we can get you the recording. Those are numbers that come from the coalition that did the press conference, and I'll just give you more specifics to provide that context. And again, these are not my numbers, but they come from this coalition.
You find that a credible prediction?
I do, because it is in accord with the national trend. And the way the numbers would work is we're losing 7% in July. We'll lose 22% of our child care facilities in September, 23% in December, and another 29% by a year from now, June. So the total number lost will be about, it's actually 82%. And it amounts to 45,000 spaces for children. And there were a bunch of other numbers. I took notes as I was going along, but it's on a slide.
And that's because they'll run out of money?
They're running out of money. Here's what's happening. You should visit one of these. I've been going around to these child care centers. Their expenses are all up. They have to provide sanitation, they have to clean, they have to have extra staff, and their revenues are way down because only about a third of the kids, on average, I found, are actually in these child care facilities right now. Because exactly, it's a perfect storm. It's a perfect storm. Parents are unemployed, so they can't pay for it. And the child care facilities have to lay off staff, but for them, it's a financial loss. I was at one in New Britain the day before yesterday, and they're talking about trying to get a loan. They've got PPP. A number of them have taken PPP, but they are going to wind up at the end of this year with a $100,000 hole that somehow they have to make up at some point, but they're nonprofit. So, you know, and this is a story all across the country. It's not just Connecticut. This is a national scandal. It is a disgrace. When you compare us to other industrialized countries where they provide it as a routine because they know parents can't go to work without proper child care, and it's an opportunity to further learning and increase educational capacity, it is a perfect storm, higher expenses, lower revenues, and the public money's drying up.
Can I answer your question?
Sure.
Okay. So I just wanted to know what happens if you don't get this funding. The hospitals want a third of the money that Connecticut has already gotten. The nonprofits want, a third of it. So when do you make a decision on how to help these other entities and when?
Yeah. The other answer on the daycare is they also have required smaller classes given COVID, so that's impacting their economic model. Look, we're in relatively good shape compared to our peers because of the rainy day fund, Christine. So we'll be able to power through for the near term. But that's not enough to satisfy the hospitals. They haven't been able to do any elective surgeries. They haven't been able to do anything non-essential, and that's costing them a fortune. It continues to cost them a fortune. We're going to get back from all the school districts in about 10 days what they think their costs are going to be in order to be able to reopen our schools safely. And we don't have the resources in-house to be able to do that. So I've got to get the Heroes Fund passed in time so we can see exactly what we can do there. In the meantime, we can allocate the CARES Act, be very tight about it, and to be able to get this thing started in the proper way.
Do you plan on giving the hospitals the $450 million they've asked for?
No, I can't afford to do that. I can afford to make a good down payment because they've been incredible partners for the state of Connecticut, and we promised them, I think it's a minimum amount of money, say $100 million. The rest is going to have to wait and see what comes out of the HEROES Act, what type of support we get, and that tells us what flexibility we will have.
And
Yeah, go ahead.
let me just add, it's also important that the HEROES Act is 2-year money. So what we need to be able to do is plan, not just for a year, but 2 years in advance. So the HEROES Act is money for the upcoming fiscal year, but money for the following fiscal year as well. I mean, we don't want to be caught in this cycle of having to do emergency budget after emergency budget. And so whatever the number comes out at, it is important for us to have some long-term certainty about when and how the federal government is going to help us fill those gaps. And listen, as a parent of 2 school-age kids, I want my kids back in school, but I know that right now the state of Connecticut doesn't have enough money to be able to satisfy all the needs of school districts in order to open, and neither does any other state in the nation. So we have to pass this and pass it very quickly. So in particular, schools and municipalities can make good decisions about how to open as safely as possible.
What is the time frame, speaking of passing that quickly? Am I correct, the $600 extra, doesn't that expire like next Friday? Or somewhere right around there? Take me through that. And I assume a lot of the Republicans said, we don't want to extend the $600 to Christmas or wherever it's going to be. What is the latest on that, and what are the realistic chances about extending that and the time frame?
So it's absolutely imperative for us to extend additional unemployment benefits as the virus spreads rapidly in other parts of the country. Unemployment is going to continue to climb, and people cannot survive, cannot put food on the table without these additional unemployment benefits. So as part of this next package, we have to continue some additional unemployment benefits beyond the basic compensation package. Republicans are very wary and very reluctant to do that, but maybe after having been home in their states for these 2 weeks, having seen the extent of this crisis in many red states, they will come back with a different opinion. I say that we should be in Washington voting, but maybe there's some silver lining to the Senate being on recess. It may change the mind of some senators who didn't want to provide those additional unemployment benefits as part of this next package.
I will just say, very few of my colleagues want no extension.
Right.
The debate is more how much. The debate is about whether it should be $600 per week or some lesser amount. The $600 represents a commitment to keep people as near as possible to what they were making before. And I think we should continue to provide that $600, but very few, if any, of my colleagues think we should just cut it entirely. So I think there's room to work there, and it can be made retroactive, to go to your timing question, just as the initial $600 was as well. And by the way, it includes also, the HEROES Act includes another stimulus payment, $1,200, which we'll see whether our Republican colleagues support. But I think the point is worth emphasizing. Our colleagues have spent 2 weeks at home. Their situations in many of those red states are certainly no better than here in Connecticut. That's an understatement. They are facing truly a precipice. It's a healthcare cliff and an economic precipice. And all in one, they need to face it. And let me just put it in very blunt political terms. November is just a few months away, and they are going to face the wrath of voters. Those senators who face election this November will rightly be haunted if they fail to act. They will be haunted, and they will be given walking papers.
What about as you plan your head? Have you changed your stance on the unemployment?
No, I think what both Dick and Chris said is, look, I think there will be an addition to the unemployment. I think it's got to go beyond this current time. And I think they'll negotiate exactly how much that is. And I want to make sure that it's an amount that also takes into account those who can't go back to work because their businesses are closed down, and those who can go back to work, an incentive to go back to work.
So you're not right now? Because a couple weeks ago you said you didn't think people should get money to stay home.
No, it was specific to that amount of money. And I think, as you've just heard, they're probably going to negotiate what that total amount of true-up is going to be.
Mark, you said said that you supported the Republican White House proposal to give people $450 to go back to work. That's what you said.
That's true. I think we ought to give people an incentive to go back to work, Paul. I think that makes really good sense, and I hope that's going to be a part of the plan as well.
Senator Murphy, can you speak more on your proposed legislation to put the federal government in charge of the supply chain for testing machines?
So we're seeing, once again, shortages of PPE across the country. Here in Connecticut, we continue to see shortages of the kits and cartridges necessary to do the kind of turnaround testing we would like, and that deficit of PPE and testing is just going to get worse as cases spiral throughout the rest of the country. Senator Baldwin of Wisconsin and I introduced legislation several months ago to force the federal government to take over the supply chain for testing material and for personal protective equipment. That provision is included in the HEROES Act. So the HEROES Act requires the president to take over the supply chain temporarily for critical medical equipment, including testing supplies. We are going to press to have that provision included in whatever legislation the Senate takes up. If you're talking about handing out masks on a daily or near daily basis to every single school children in this country starting in the fall, we don't have the capability to produce that number right now. We are going to have to dramatically upscale, and we have willing partners. I just left a manufacturer in Cheshire who is months away from being able to start up a new domestic source for these masks and for N95 masks. But he needs to have a guaranteed contract from the federal government in order to start that effort up. So
We'll give them a guarantee.
if the federal government doesn't do it, you'll do it. But you need the money to be able to provide them the funds, and that's in part why we need to pass the HEROES Act. It's got money for the states to continue their own PPE efforts, and then it requires the federal government to take over the supply chain temporarily, as is done so in the legislation from Senator Baldwin and myself.
This has a key local impact. I was at Federally Qualified Health Center yesterday in Fairhaven. They're waiting a week for test results. The usefulness of those test results goes down every single day. If they're positive, someone has been in contact with a myriad of people over that week. And if they're negative, that person could have quarantined unnecessarily. That's in Connecticut, where our numbers are great by comparison to the rest of the country. So these delays in testing have an impact. If Connecticut's going to reopen its schools, bricks and mortar, it has to multiply the number of tests 5, 6-fold, whatever. So Chris's point about the supply chain is really, really important. It has a local impact. And I just want to second a very important point that Governor Lamont made about PPP. What I'm finding is a lot of restaurants, particularly event planners, businesses that use their PPP, they paid their employees. It's been turned into a grant, but they're still waiting to reopen at a level where they can break even. They need another round of paycheck protection money. And by the way, I proposed something called the Paycheck Security Program with Senator Warner, Senator Sanders, Senator Doug Jones of Alabama, that would provide businesses with all the money for their payrolls up to $90,000 per worker, as long as they can show a 20% decline in revenue month over month, which would eliminate a lot of the confusion we've seen about bigger businesses getting more money, smaller businesses being denied access. We clearly have to do better on PPP. But the governor's absolutely right. There's $130 billion left in that account. $130 billion, we're talking real money. And there's no reason why it can't be used for those small businesses and minority-owned businesses. 41% of all black-owned businesses have gone under as a result of this pandemic. 41%.
Is there a plan to further protection against evictions?
Yes. In the HEROES Act, there is a rent stabilization program great questions. I'm so glad you asked. To prevent homelessness. Preventing eviction is really about preventing homelessness. Stopping evictions through this Rent Stabilization Act will be game-changing for housing in Connecticut and around the country, because it will help prevent homelessness. It will give people the kind of short-term aid they need simply to stay in their home. Evictions are bad for landlords and they're bad for tenants, but it's a dynamic that is unstoppable unless we pass the HEROES Act.
And then is there any money going to be given to landlords as well to help them with the loss of revenue from not getting rent?
Landlords are eligible for PPP, and the rent stabilization or eviction stabilization program, the money can be used to pay rent retroactively if tenants have in effect been using the moratorium that the governor has made available.
Can I just add to that?
A little bit more detail of what that looks like, because people haven't been paying their rent since April. Come, what is it, August 25th? Landlords are going to say, back pay me, but these people who haven't been working obviously don't have money to pay months of rent in one lump sum.
It will depend on how much money is actually allocated. There needs to be money to prevent evictions going forward. That ought to be the priority, because homelessness will scale up on an unimagined rate. But paying retroactively is also important, and hopefully there'll be enough money in that fund to pay for it.
Mind if I just add to that for 1 second? What we're doing at the state level, and we could sure use your help on this, is we've got tens of millions of dollars. We're still figuring out the final number is that we're going to be able to use with landlords so they can negotiate with their tenants a payment plan over the next 6 months. So we're giving them incentive to negotiate that plan, and you're right, no evictions through August.
Is that beyond August, though, that payment plan?
Yes, that payment plan would incent landlords, give them some money up front to make it easier for their tenants to negotiate how they pay over the next period of time.
Would you consider a rent abatement?
I think I like the way we described it right here. So it gives people a little more time to make the rent payments due.
I mean,
A lot more time.
Yeah, I mean, listen, ultimately you've got to help people make rent payments. You can only prohibit evictions for so long because the foreclosures will begin. So what we're talking about is a federal fund to help low-income people pay their rent. And by doing that, it then stops evictions, but also puts money in the pockets of landlords so that they can pay their mortgage.
That $130 billion, what would it take to allow people to apply again then for it in the way of writing?
Well, you can listen. There's you could allow people to apply for a second PPP loan. You could also, well, you need legislation to do that. So you would need to include legislation to allow people to apply a second time, and you probably have to set up a slightly different set of parameters for it. There are a number of different proposals on what should follow PPP. I think there is broad agreement that there needs to be some additional business assistance program to follow PPP. To my mind, it likely has to be more targeted. It has to allow businesses to use the money for things other than payroll. And I've introduced, full disclosure, I've introduced several colleagues a version of that program. But the reality is that this is a mass extinction event for small businesses. And our world is not better if Amazon and Walmart and CVS just get more powerful and more powerful. And so we have to have an ongoing strategy that includes a temporary short-term subsidy to keep small businesses alive. Or when we emerge from this pandemic, you aren't going to be able to buy anything from anybody other than Amazon and Walmart and Target. And that's not good for our economy, and that's not good for consumers. So the governor's got an idea to just allow people to go back and use another shot of PPP. You could also use that money and do it and tailor a program to the industries that are most in need of additional subsidy. But something new has to happen.
There is a possibility, and we're looking at it, that the Treasury Department could alter the regulation and enable businesses to go back for another tranche of PPP money. Right now, many of the businesses, if you talk to businesses in Connecticut, which I know you've done, some of these small businesses received a pittance I was at one yesterday in New Haven that's received about $26,000, and its potential revenues are way in excess of it. Its payroll needs are much larger. So the way the PPP program works is lenders, and hopefully more of the community banks and non-bank lenders, fintech, PayPal, could provide more of this money. Even under the current legislation, we're looking at whether or not the Treasury regs can be changed to make it possible. But as Chris says, it may require new legislation.
All right. Great. Thank you, everybody. Appreciate it.
Yeah, you don't have to keep these guys. I just want to talk about nursing homes.
What was the question?
Something about nursing homes?
Yeah, you had mentioned that you wanted to see legislation that comes from nursing homes, and it's not part of the special session. Are you waiting for the report, or why not do something now with this upcoming session?
I don't know what legislation you're thinking about there, but whatever it might be, I think let's get the report so we go in with our eyes open and see what we did right and what we did wrong. And the main point of the report we're going to get is they work with nursing homes around the country so that if there is another pandemic surge, we're ready.
And is there anything that nursing homes can do in the time being, like have cameras or something like that, so loved ones can see their families, or there's anything that they can do now while they wait?
Well, short term, what they're doing is having visitations, mainly outside. We're allowing them to individually negotiate, having a member be able to go in and see a loved one. It's really important, too, for the folk in the nursing home, especially those with some dementia, to be able to see that person they've always known, bring them back. So we understand that all too well, but I'm sorry, you saw what happened when people walked in with a virus, so we're being very careful.
And there is money, by the way, in the HEROES Act for nursing homes. There's, I think, don't hold me to it, we can give you the exact number. I think it's $25 billion for nursing homes in the HEROES Act.
All right. Thank you, everybody.